let's take another question, and it is from Mahesh. So it is regarding the blood glucose levels. Can blood glucose levels be monitored at home? How does this compare to monitoring done in a hospital?
Wonderful. So yeah, blood glucose, as we see the evolution, we used to check blood glucose, as I mentioned earlier, only in the olden times with urine. So, even it's in our ancient scriptures, it says that if you pour urine and if ants come and, they will come to eat the urine because there's too much sugar in it. But now then we had the urine test where we use certain reagents to check blood sugar. But now, since the early 80s and 90s, we've been using a finger stick blood glucose monitoring, where you just poke your finger, put a drop of blood on a blood glucose meter, and it gives you a blood glucose instantaneously using test strips. But unfortunately, it can be expensive because to get a good quality test strips. But now we have technology where we place a sensor on top of the skin and it connects to your mobile phone or a reader. It gives you continuous blood glucose measurements, which can be very easy to monitor. It can prevent a person from, it'll alert if your blood sugar is going too high or too low. So nowadays it's been very easy. They connect to smart pens or insulin pumps. So yes, blood sugars can be monitored continuously like an EKG. How does it differ from blood glucose monitoring in the hospital? So in the hospital, we use venous blood glucose. That means they draw blood from a vein, and then that would be sent to an analyzer. Whereas the blood glucose monitoring that we do at home is capillary blood glucose. So there can be a little bit difference, very minute differences between a capillary blood glucose and venous blood glucose. But again, that is not it does not change our management. So we can use both interchangeably, yes.
Okay. Appreciate the clarity, doctor.